Hi and welcome to this first in what we hope will be a series of videos for frontline family violence workers and therapists. This is a collaboration between several agencies and individuals, far too numerous to mention here, but all the details can be found on the Centre for Excellence in Child and Family Welfare website. We'll be giving you a link to all the information and resources at the end of this video. So, some introductions. My name is Nick Carr. I'm a GP, writer and broadcaster, and I have the great privilege today of having with me some of Victoria's top experts in this field. So without further ado, I'm going to ask them to introduce themselves. Wendy.
Hi, I'll first introduce Coco.
The most important member of the group.
Most important member of the panel, and who is like a secret little consultant. So she will be participating in this today. My name is Wendy Bunston and I am a clinical consultant. I have completed a PhD looking at the experience of infants who enter women's refuges with their mothers post-family violence. I am very interested in infant-led practice and am a social worker, family therapist and infant mental health clinician. That'll probably do.
All right, thank you. Perfect person to have with us. Thank you very much. Helen.
Hi, thanks Nick. I'm Helen Fittle, maternal and child health nurse at Hobsons Bay City Council. I've been working as a maternal child health nurse for 12 years and I have a lot of interest in families and family violence because, as you probably are aware, we have access to or see every baby and family that gets born in Victoria. So we have a lot of contact with those. And yeah, this is really interesting to me because of this current environment and how we can help those vulnerable families out there.
Yeah, thank you, Helen. Of course, maternal and child health nurse is absolutely central to this work. So fabulous to have you on board. Thank you. Karen.
Thanks, Nick. I'm Karen Gaunson. I'm a child psychiatrist and I work in private practice as well as in a public kin service in an infant and preschool team. And I've given evidence to the Children's Court for protective matters.
Okay, thank you very much. It's wonderful to have a child psychiatrist with us. And last but very much not least, Kim.
Hi, Nick. Kim Schroeder, Clinical Manager of Restoring Childhood that sits in Take 2 at Berry Street. And I'm social work trained, but I've managed lots of youth programs, family services and family violence programs, and currently manage Restoring Childhood across 3 different regions.
Okay, so thank you so much. So why are we here? Well, working with family violence is hard enough at best of times, but this new COVID world of lockdown and social distancing has really thrown up a whole raft of new challenges. So what we want to try and do is create a platform where you family violence workers and therapists can get suggestions and most importantly, have your questions answered about how you can remain therapeutically attuned and effective when face-to-face work is not possible. We'll be giving you a link at the end where you can send your questions and queries after this is finished. But right now, we don't have your questions. We don't have them yet. So in this first video, our expert panel is going to offer some of their tips and suggestions about how to do this work when we're all stuck on Zoom and FaceTime and that sort of thing. Wendy, I'm going to start with you. Can you give us your tips about how to manage in this strange new world that we're operating in?
Yep. The thoughts that I've sort of been coming up with are around being tempted to think in absolutes when I think we're all finding our way at the moment. So being able to give ourselves a little bit of scope to not have all the answers, but to be committed to trying to find out what's the best way to do things in this new way of working. Not seeing the infant, I think, is not particularly new to our sector. I think you can have the infant in the room with you and still not really see the infant or think about their perspective or experience. So maybe in some ways this time of being more apprehensive about not seeing infants and young children might help us begin to think about how do we actually see the infant with our mind instead of being so reliant on seeing the infant with our eyes. So from my experience of working with infants and from doing a little bit of work online with families as well. It's about, I think, using all our senses to try and be mindful of what might be going on in the lives of families, to listen for the way people talk, whether it's by phone or whether you get to see people online, being able to sort of think about what are the patterns of the things that they're telling you about their experience, and us as practitioners being able to use our mind to reflect on what it is that we're hearing. So it's about a lack of reliance on visuals, but we know that a lot of communication doesn't always happen through visuals. So being able to sort of think through, okay, what might be happening at the moment, and keeping ourselves regulated as we're doing work online and doing work by phone. So for me, I think that there's 7, and I won't go through them in detail, but for me, I would say number 1, where it's safe to ask direct questions, to assess the safety of infants, children, and their parents. 2, bring the baby literally into the space through reflections or comments in the conversation. So ask some questions about, if I was to see your infant at the moment, what would I be noticing about how they're looking at you, or what they're doing in their body? Or being able to say, if I was to ask them to get on the phone and tell me what it's been like these past 4 weeks, what would they tell me? What would they tell me about what it's been like to be you as their parent? Being able to comment on what you do see and hear. So you might hear a baby in the background, or you might see an infant. You might see a little Coco, and you might just make some observation, or consistently bring that little one into the space. 4 is about keeping in touch. I think it's really critical at this period in time that we keep in touch with our families, and that might mean texting, it might mean letters, it might mean dropping goods off at their house. It's following up, and if they cancel, just continuing to follow up and letting them know that you have them in mind at the moment. I think that's going to be really important for some families who are feeling isolated and unsafe, that they know that somebody out there is keeping them in mind at the moment and keeping a check on them to see that things are okay.
And Wendy, I'm just going to clarify that one with you, because I imagine this is something which is pretty core to the business that you people work in anyway. But I think that's a lovely, simple example of the sorts of things that people might otherwise miss out on. Maybe someone doesn't answer a phone call, maybe someone doesn't pick up, and they don't follow up. So what you're saying is that capacity to follow through.
And in the creative ways. I mean, I'm hearing all sorts of amazing things that people are doing to let clients know that we are thinking about you, that we are keeping you in mind, and that we're continuing to provide a service to you. So it's been pretty spectacular, some of the things that people are doing. 5 would be to act only when it's safe to do so. So be really careful about, I think, your assessments, and ensuring that you don't, I guess, and I think Karen will probably speak to this a little bit, is that thing that our clients often already have well-developed defence or safety mechanisms about how to cope in difficult situations. I think we need to be a little bit led by them, because if we go in and have not really assessed the safety of the situation, we could make things worse. So I think it's something we need to just be mindful of and consult. So that's for me number 6. Consult with others, consult with your managers, use reflective supervision. And like, this is an example today of, we have got together as a group of professionals, not because we were told to, but it sort of began through a conversation that Karen and Kim had, and it sort of led to other people coming on board. And we're working in a really collaborative way. So I think that's really important. And then my last point would be practice self-care. It's really important for people who are keeping in contact with people in crisis to also recognise that you can't be all-knowing. You can't know everything to do. And it's a really hard time for families, but it's also a really hard time for workers who are feeling apprehensive and feeling afraid and scared for their families.
And I love what you said up front about there's a lot that we don't know, a lot we're going to get wrong, and that's okay.
Yeah.
Allowing
I'm
yourself
sure there'll be
not to
lots we find out at the end of this. Yep.
Yeah.
And they would be they're my main points.
Okay, that's a huge amount of turf. Does anyone want to comment on what Wendy's just said before we move on?
It was a fantastic start, and I want to acknowledge the pioneering work Wendy's done with other colleagues in this area. An article she's written really about bringing attention that more needs to be done in the mental health sector and that I work in. So, yeah,
and I'd just like you to know that Coco's been with me every step of the way. She usually sits here while I'm writing, and she adds her comments.
And that's a good point to remind anyone watching this that there will be a very valuable list of written resources that are available on the link on the website after this is over. All right, Helen, can I cross to you?
Thanks, Nick. Thanks, Wendy. Probably a lot of the things that I was going to talk about, you've sort of mentioned there anyway. One of the big things as nurses we are finding difficult is obviously not having that face-to-face time, which you've mentioned, but also how vulnerable the worker is feeling in this new environment that the world is at the moment. And I think, as you said there at the end, looking after yourself, but looking after each other and looking out for each other and being mindful that we're all going through this together. And I think once we sort of start to think about that it can help us to cope with what we're having to do. A lot of the responses when I asked my team about how they were going with this, and in particular with asking about family violence and things, was the difficulty of asking the mother, who's normally the one that is speaking to, who else is in the room, and how you can do all those sort of things in a safe way. Again,
and Helen, I'm sorry to interrupt, but your audio is a little bit flaky, so I just want to... Yeah, but what you just said is so important. It's about how you ask, say it again, who's in the room?
Yeah, how do you ask who else is in that room with you? And so that's probably one of the first questions that when you're making a phone call is to sort of ask them, is it a good time to talk now? Is everybody at home with you today? So that can often give some feedback as to, okay, I'm not going to go in a certain direction with that conversation if there's somebody else there in the room. And saying to them, how are you going? It's a stressful time at the moment. And in these stressful times, how do you cope? How do the other people in the family cope? And that can often lead to things like they might talk about the use of alcohol or drugs and things like that. So they're all the things, some of the questions that you can ask if it's a safe place to do so.
And how do people know if it's a safe place to do so? How do you make that assessment?
Well, if they can, most of the time the mother will, but if she says there's somebody else in the room, then the nurses will know not to go and ask those further questions. And often you can tell just by the way they respond, their voice, yeah, and so you just know that this is not the right time to be asking those questions. And then checking in with them and when's a good time to ring again, and you can ring back with an excuse like, the nurse is going to ring me again because it's the COVID, and they can have that time to maybe make some time available where they're going to be on their own and things like that. So just some simple little things like that can make it a bit safer and for the family, for the nurse to be talking to the family there as well.
So thank you very much. And one of the things I'm hearing there is that we're always, of course, aware of the more non-verbal kind of cues, but maybe this is a time when we have to be really powerfully attuned to the tone of voice, the expression, some of the hesitations, and interpret them much more strongly than we might do in a circumstance where we've got more information. So yeah, okay. I think that's really, really helpful. Thank you. And I'm sorry, Helen, to interrupt, but it's just a little bit echoing on your sound. That's what happens when you throw all these things together with fairly limited resources and time. But we'll make the best that we can. Karen, can I turn to you, please?
Sure. I was going to change tack a bit because that's some really useful practical advice that Helen's just given. And I was going to take a step back and really look at the overall context of where we are. And there's kind of two things to look at. One is the extraordinary circumstances of this pandemic, that no one knows what's going to happen. And there's rapid change, and people have found themselves in really unexpected situations. And that's incredibly stressful. So whatever executive functioning the people might have might be quite overloaded at the moment, perhaps by the binge alcohol use, as well as just the stress of sudden unemployment, distress in relationships, massive change of roles that people are going through. And that can apply to workers as well as the people that we're supporting. So it's really important to kind of just acknowledge that this is an unprecedented period of stress.
The first use of the word unprecedented. Now,
Yeah.
I'm going to have a rule in this video. You're allowed to use that word once and never again.
Okay. And while we're like marking that word, can we also mark kind of the orange theme? Have we done that yet?
No, go ahead.
You might notice that we've all got a bit of orange, and that's a nod to the orange door, because we're working in a system here that's set up to support families. Yeah. So I guess we don't know what's going to happen, but we do know that there's financial hardship. And in the 3 years after the GFC, there was increased rates of non-accidental injury of infants. So, you know, the families that we're working with, we need to try to prevent those awful type of outcomes. So there's a lot of myths that we're up against. There's myths that babies aren't impacted by what's happening around them and that they're more resilient than people think they are. Anything that happens in infancy has a disproportionate impact. It actually impacts on whole of life outcomes and even intergenerational outcomes through neural wiring, hormonal systems, the HPA axis. And when parents are overwhelmed, when they can't meet their own basic needs or their child's basic needs, it's really stressful. And they're not going to be as attuned to what the baby's telling them, and they're going to miss the signs. They're not going to know how really to soothe the baby. And so it's really important that we meet parents where they are in terms of what are their tangible goals? What do they need? And these needs have really increased massively. And there needs to be some, hopefully the governments will continue to make some better choices about meeting people's basic needs. That's going to go a huge way to preventing, I think, some of the non-accidental injury and reducing the rates of family violence. But yeah, I guess I really wanted to make that point.
And Karen, you mentioned that after the GFC, there was an increase in the rates of non-accidental injury. Do we have any information in these early stages of COVID, whether there's been any record of that happening at the moment?
I don't know. I don't have the stats on that. I think in subsequent webinars we might involve child protection. But I think there's a sense that phone calls have gone up to the men's helpline. They're not, I think Kim can speak to that soon. So I can't answer that question. But I think there's a concern that, child maltreatment's underreported anyway. And at the moment, it may not be safe to report that. The child's going to present to ED in extremis. And I'm not sure of rates of.
And you also made the very important point that substance and alcohol use always an issue, but we know that alcohol sales have rocketed in recent weeks and months, and so perhaps people need to be particularly attuned to the risks that people are overdoing substance that they're at risk of.
Yeah, that's right, because binge alcohol use really puts your family at risk and your future at risk.
All right, thank you very much. Kim, can I turn to you, please?
Sure, Nick. I'm just going to have to wake my sleeping dog, otherwise you're going to hear snoring.
Let sleeping dogs lie.
Okay. So here's Muppet.
So we've got a dog contest going on.
We do, yeah. So now you won't hear her snoring in the background. But just picking up on what Karen just said, it is concerning that there has been a significant increase in telephone calls to the men's referral service. Off the top of my head, I think it was about 67% in the last few weeks. So obviously, men are accessing that service, but we're seeing men that are accessing that service that wouldn't ordinarily. So they're not doing any face-to-face work at this point in time. They're doing telephone contact. And also the L17s, so the police referrals, are down in both the northeast and in Hugh Moreland, which is also concerning. So that means that obviously reports aren't being made and that Child Protection are doing very limited visits. So they're only seeing the most high risk families at this point in time. And just picking up on what Wendy, talked about earlier, I just wanted to say that we've absolutely adapted our work in restoring childhood. So we've been thinking about how we do dyadic sessions virtually with families and how to make that safe. We're getting some feedback about in terms of homeschooling and multiple kids being at home, multiple children being at home, that's making it a bit difficult because it's not appropriate to have multiple children in an environment when doing so. But certainly we have been delivering some food parcels. We've been thinking about how to engage clients in a different way and increasing our capacity to be able to respond to the increased referrals that we've received.
And when you say how to make dyadic sessions work and be safe, can you just expand on that?
Yeah, sure. So in terms of doing dyadic sessions, we've had lots of conversations about safe spaces within the home. So some of our work...
and sorry, I'm going to interrupt you again, just for ignoramus like myself. What does a dyadic session actually mean?
Oh, okay. So I work with a bunch of therapists, Nick. So they're all
exactly.
therapists and provide, therapeutic interventions. So Wendy actually does a bit of consultation with us, and we've been talking about how to also provide Peekaboo, the group, virtually via Zoom. So they're in the beginning stages of that, and Wendy can talk a little bit more about that. But in terms of safely delivering dyadic sessions, we're just mindful about who's in the home and how to do that, because obviously therapy doesn't usually get provided in the home, and for good reasons. So we are just starting to do that virtually. And obviously there's a lot of clients that don't have access to resources, so don't have laptops and desktops, things like that. A lot of women use their mobile, but sometimes that's not appropriate, obviously, to do dyadic sessions on. So we're just thinking through how to adapt our work and obviously to respond to the needs of clients at this current time during COVID-19.
So one of the things that's come up from everybody who's spoken, and it's obviously crucial, is that question of safety. I have in my mind a worker who's saying, I have this family I'm really worried about. I can't physically go and see them. I'm not sure what to do, how to check up, or how to ensure that the kids are safe, or the mum's safe, or whatever it is. Do people have some tips or advice for workers in that kind of conundrum?
So we've just recently been talking about assembling some teams across different regions in terms of how to engage these families that we're concerned are falling through the cracks. So it might be going out and delivering a food parcel. It might be going out and reading to children, into obviously adhering to social distancing measures. But yeah, to dress up in costume, music, things like that. So we're at the very beginning stages of that, but certainly there's a lot of work going on in that space at Berry Street.
Do you ever take the dog along?
Not yet, but I might, Nick.
Might be the most therapeutic thing we could do.
Sorry,
Wendy, you're muted. You'll have to unmute, Wendy. We can't hear you.
I said in a clown outfit.
Yeah.
As long as it's orange.
Yeah, that'll be me. Yeah. That'll be me, Wendy.
But I will add to that. I think one of the most powerful things we can do at the moment is keep in touch. If we are clear that there are safety issues, we need to consult with Child Protection. We need to consult with other professionals involved. I think if we can safely act, we should act. I don't think we should not act. But I do think one of the protective things that we offer is that families know that we know that we're a bit worried and that we're around, that we're going to keep in touch with them, that we'll keep them in the forefront of our mind, and that we haven't just disappeared because it's not safe for anyone to be near another person. So I think it's exactly that sort of stuff where I think some amazing things are happening out across the sector, where people are doing the parcels, coming up with really clever ideas about keeping in contact. And if you're being brutally honest and you do have a family where you have suspicions that they might be, I mean, I've heard people talking about being told that, you can't go out because if you go out, you'll get COVID-19, and this is the reason why you have to stay in, and all sorts of threats that are being used to keep people inside. If you have a pestering service like we can be, but a good, benign pestering service, maybe that's just the plank that will actually help people stay safe. The fact that there's some people hovering around that are keeping an eye on things and saying, we're just making sure that everything is okay. Look, I don't know if that's true or not, but I think rather than doing nothing, the more we can stay connected, I think the better chances there are that people might get through this.
Okay, Karen.
You're just elaborating on that. Don't be a lone ranger. You're working as part of a team, and when people collaborate, you're going to think much better, and you're going to be able to help the family think a lot better. So building that network of people that know the family well, that they trust, is like absolutely crucial. And to recognise the limitations of each person's role, that we can't do the type of assessment we would normally do, and to actually not try to do the old tick box, because it's not going to work. So really being very clear on what you can do at this point, what information you don't have, sharing the information in a nuanced way, not catastrophizing, being as accurate as you can, and planning what you're going to do as it becomes easier to see people in person, and being open to new information too, I guess.
And one of the things I've heard it said by other people is that we have to pare things back a little bit. We have to go a little more basic and a little less sophisticated sometimes. And in some ways, Wendy, not suggesting that Winnicott is not sophisticated, but what you're talking about is a very Winnicottian keeping in mind and just using that therapeutic benefit that someone hasn't been forgotten.
Yeah.
And I love that because it's both highly sophisticated, but at another level, fairly straightforward.
That's because he was married to a social worker.
See, he was a smart guy. All the best people
Yes.
are married to social workers.
Yes, that's right. But I do think people are being, I don't know, I feel like there's an energy in the sector around us all pitching in at the moment.
Yeah.
I think lots of people are sort of reaching out to other people and saying, what can we do to help? So I do think there's a spirit of collaboration that's been quite nice in this time.
Definitely.
And all I can hopefully, that it continues on. I'm just thinking some of the things that our learnings at the moment, even when we come out of this, I think there'll be some gains from what we learn in how we continue to talk with, we collaborate, and have more frequent consults with not only with our families but with each other and things as well too.
At a very simple practical level, one of the tips that we got very early on doing telehealth in general practice was to make sure that we turned off our phone ID before we rang patients. So we didn't hand over our private mobile numbers to hundreds of people out in the community. And it's probably worth reminding anyone involved in this kind of work who's now using their mobile phone to contact families and so on, just check in your settings that your phone ID is turned off so you're not making yourself available to all and sundry. We've only got a couple of minutes left before we have to wind up because I reckon 30 minutes is about all anyone can concentrate on in the video. So just in the last minute or two, anyone else with a really practical tip or suggestion for people who might be listening to this?
Have a look at the pandemic kindness movement, the hand-in-hand peer support for healthcare workers. There's once again that generosity that people are coming forward and offering their skills in whatever way they can, and really recognising that there's enormous benefit to sharing experiences with peers.
Okay. Kim?
So the Northern team do moments, Nick, and so we talk about obviously memorable moments throughout the week and share them with each other just to keep our spirits up. So that's something that, you know, I think that is really valuable in this space, because, you know, we've all gone through our ups and downs in past weeks, and the unknown can be very anxiety provoking. We're all just human, so we should just be kind to each other.
Yeah, I'm hearing a lot of emphasis on collaboration, using peer networks, making sure you discuss that peer support and supervision, and kindness. Oh my goodness, that goes a very long way. Helen, just before we wrap up, any last thoughts for our audience?
No, I think we've sort of covered everything that I had thought about it before today. And it's, I think, just looking after each other and continuing to think you can keep contact with those families that you're concerned about, that it's not just a one-off or, you know, twice or whatever else, but there's no harm in just saying, hey, how you going? Yeah.
All right, thank you. Well, that's about all that we have time for today, but we'd love to come back and do this again, but we need to know what you want to know. So if you have specific questions around working, for example, say with Indigenous families or more rural or remote settings, or families from culturally and linguistically diverse backgrounds, let us know. So please stay online after this and give us some feedback. There'll be a questionnaire and a space for you to ask us stuff. Tell us what areas you'd like us to cover, any specific questions you'd like addressed. You'll also find a host of valuable resources available at the event page on the Centre for Excellence in Child and Family Welfare website. So that just leaves me to thank our wonderful experts who've given up their time to do this today. Wendy Bunston, it was a wave, Wendy. Yep, from the dog. Helen Fizzle, thanks, Helen. Karen Gaunson, psychiatrist. Oh, she's turned around. And finally, also Kim Schroeder. Thanks very much. Oh, with the beautiful puppy dog. I've been Dr. Nick. I've been Dr. Nick. Thanks for watching, and we look forward to talking to you next time.